Okay. Thanks again for inviting me to take part in this discussion. And I think Alain has laid out a framework how international unions and also lawmakers, stakeholders can make use of the recommendation 205 as a framework to address the crisis and disaster situation, the pandemic. I will focus on the what is happening on the ground. What do we see at the policy response level, especially to what is happening at the workplace. We have a particular concern on occupational safety and health for workers, as well as the crisis response in terms of healthcare infrastructures. So if I can go to the first slide. Now, talk about the ASEAN region. All of you will know very well travel restrictions, movement restrictions are on. A lot of the countries in the region, they have banned non-essential services and also non-essential workplaces. But in fact, if you look at what is happening in each country, there are still a lot of production, economic activities going on, although we see in the case of Malaysia, for example, very stringent control of people's movement. Here is a number of countries where you still see, for example, in the Philippines, I'm also surprised to see, for example, the export-oriented industries are still operating in the export processing zones, business process outsourcing companies as well, even in Singapore, although the banking, financial, commercial sectors have temporarily closed, but at the same time, you see manufacturing and packaging, even semiconducting manufacturing is grouped under essential services, which the government has exempted from what they call the separate brick. Same for Indonesia. There are strategic industries, construction, hotels, etc. that is going on. In Vietnam, the factories are still operating in special economic zone, industrial parks, high-tech parks, etc. In Cambodia and Myanmar, the coordination of stay-at-home and travel restriction is not so well. And in Cambodia, you will see, in fact, after the Khmer New Year, the Prime Minister has already basically put things back to normal, and people can walk freely on the street. And if you find workplaces closed, probably that's also because of the supply chain breakdown rather than administrative lockdown on production sites. Next slide, please. So of course we have to ask what is happening in the workplace. Given the highly transmissive disease, how are people protected if they still need to go to work? Already you see some cases reported in the media about the conditions of people that still need to go to work. In the Philippines, it's become a scandal now for the contractor of Apple and Facebook, the service provider, Teleperformance. There is a complaint to the OECD by a Global Union Federation, UNI, about multiple work sites where workers, for example, in the cases of Philippines, they have to sleep in cramped dormitory places because they also face travel restrictions at checkpoints, and the working conditions and also the living conditions are very poor. Amazon workers in the States in 10 warehouses, they are protesting for lack of PPEs and possibility of physical distancing at the workplace. And in Indonesia, we also have heard from our affiliates, unions are afraid of transmissions at the workplace and lack of precaution by the employers, and they are calling for a close down of production. Next slide, please. So in general, for workers that still need to go to work, they are faced with different kinds of problems. Transportation is a major thing for them, and a lot of them also faced harassment at the checkpoints by the police or even the military. They still need to go to work, but their kids cannot go to school. There is a serious lack of child care support, even elderly care support. And a lot of them do not have access to clean workplace hygiene facilities. They are also under a lot of work pressure. For example, even the delivery workers in Singapore, now they have to abide to an extra set of hygiene rules, which they themselves have to take responsibility for not complying. And they will face penalties, even a ban to work for 12 months if they are fined by what they call the circuit break ambassadors. So, and there are also, the impact on women has not been fully captured. We are aware of increased domestic violence, extra pressure on, again, childcare, and also unpaid domestic work on top of the work they need to do in the essential services. Probably people hear a lot about what is happening in the healthcare, where the workers do not have PPEs, but they are most exposed to hazards at the workplace, and they have long breaks, long hours without breaks. And there are also shocking stories of healthcare workers having burnouts and also assaults or discriminated by people in the community. Next slide, please. I mean, in general, people in different sectors faces different sets of problems. It is a good thing, and the Global Union also support the conversion of hotel to quarantine centers or accommodation for healthcare workers, but there is a big concern about the lack of proper safety training. Again, for logistic and transport workers, they lost a lot of time and therefore their pay, because they need to reroute, and there are checkpoints, and they also face harassment. Big concern for outbreak in the confined workplaces, for example, in sea vessels or even in a warehouse. Supermarkets, retailers, and even workers in the industrial sectors, they are exposed to large areas of touch surfaces, and it's almost impossible to have physical distancing at the workplace. And public emergency service workers, again, they face with a lot of pressure, long working hours, again, also assaults and abuses. Next slide, please. So again, if we go back to the ILO framework on workplace safety and health, there is a whole set of tools that we can use to improve protection in the domestic laws, and also to support the policy responses for strengthened workplace safety and health protection under the pandemic. However, I want to point out, if we look at the ASEAN region, the ratification of these major occupational safety and health tools is low. For example, the major convention 155, only Singapore has ratified it. The nursing personnel convention, which regulates the working hours and also working conditions for the healthcare workers and nurses, we have only Philippines and Indonesia ratified it. Next slide, please. So if I can go through very quickly what are the major principles laid out in these different tools on occupational safety and health. Is first and foremost the state and also employers' responsibility to provide a safe working environment and to minimize risk with precaution and also protective measures. The workers have the right to be informed, trained, consulted. They should be there, take part in the risk assessment, management, monitoring, and remedies. The list of occupational disease should be reviewed and updated. And most importantly, and also mentioned by Elaine, the right to organize and bargain collectively, and also the right to withdraw from work is a fundamental right underlying the protection of health workers, public services workers. They should not be excluded from exercising these rights. And the WHO in particular have also drawn up a whole set of guidelines and regulations on the pandemic. And I want to highlight especially the security measures for personal safety of the healthcare workers, and also their right to receive compensation, including their dependents, if they are infected with COVID-19 from work. Next slide. So there are,
sorry.
Yeah, I will quickly go through some good practices, but there are also gaps. ASEAN governments have drawn up workplace guidelines. So Singapore, for example, there are sectoral advisories as well as recently addressing dormitory outbreak. Malaysia, they request employers to ensure health screening. Next, please. Same for Vietnam, they are adopting a rating of the workplaces by infection risk. Next, please. A lot of the measures also try to identify in the very first place hazards, and this is done by mask screen tests. Singapore government also makes sure workplace inspection is still going on. It's interesting to see in the ASEAN countries, PPEs are still manufactured for self-sufficiency, hopefully in the longer run. And there are also free quarantine and wage protection, free treatment for workers infected. And Malaysia has designated COVID-19 as occupational disease. Next slide. For benefits and rehabilitation, a lot of the countries have paid sick leave. It's interesting to see, for example, in Vietnam, parental leave is also provided. Some countries are able to give special allowances to healthcare workers and government frontliners. Most of the countries, they have social protection and try to extend their coverage to those that would be normally excluded. This is done, for example, by deferring the payment of the premiers and allowing voluntary contribution. However, there is also a risk of mass unemployment, which lead to these regular workers being thrown out of the safety net. And next, please. But if we look at whether people can exercise these rights, we do have concerns when we see in the labor laws in many of the ASEAN countries, many workers are excluded by law and practices from being protected by the safety and health tools and standards. For example, the service contractors, agency workers, fixed term or temporary workers that are put to work on a long-term basis, misclassification or disguised employment, and undocumented workers. So not to mention that a lot of the workers, even in the health sector and public services, they are casualized and therefore they're excluded from the labor law protection. Next, please. Whether there are good domestic framework for freedom of association and collective bargaining is also fundamental to workers being able to exercise their right for occupational safety and health protection at the workplace. So the Malaysian government, for example, encourages collective bargaining, but we also understand that employers are not, will refuse collective bargaining as a practice. And The workplace safety and health committees, a lot of them are also not functioning well. Trade unions are excluded in the development of national stimulus packages and workplace monitoring. And the lack of protection for collective bargaining, as well as automatic dissolution of trade unions if the factory closed down. This is a major issue in Cambodia and also Myanmar. And we also see the pandemic also give an occasion for the states to expand the emergency powers. We do see trade unions activity significantly drop, and many of them are even under surveillance. Next, please. And the right to exercise strike is very difficult by healthcare workers, as you may see from the example of Hong Kong. But however, in some countries like Myanmar, the workers are still able to take industrial actions to demand paid leave. We have a concern also about the wide scope of the essential services. Under the emergency law, the ASEAN government are allowing them to operate. It is a very wide scope, as I pointed out in the beginning. And the emergency services would also mean a lot of restrictions when workers want to exercise the right to take industrial actions or to withdraw from work. In Thailand, for example, we see the state-owned enterprises and the public enterprises, trade unions are criminalized, for example, in the railway services for taking on strike. Workers and trade unions are also criminalized for taking part in speaking up in public protests. There are also threats of further erosion of fundamental rights in the Philippines, in Cambodia, or trade union rights through the discussion at the parliament level of the omnibus law in Indonesia. I have to refer again to the fundamental rights protection for workers in the essential services should include the right to freedom of association and collective bargaining. This is also true in the ILO guidelines on decent work for public emergency services. In this guideline, there is also a mention about the danger of privatizing, outsourcing, and casualizing workers in the public emergency services. Next, please. So as good practices, a lot of the governments are also increasing in healthcare, manpower, procurements. But at the same time, we have to emphasize the increase in the healthcare budget should also be based on promotion and protection of decent work in the healthcare sectors. And again, our affiliates and also the ITUC, we are supporting the build-up and also improvements of universal healthcare and universal social protection for all. So I think I'm running out of time, so maybe I can stop here.